Hello, everybody. Of course, it's me, Alex Grichuhin. Though I'm having a little bit of internet complications, I'm hoping it doesn't interfere with us too much. So, but we'll go that route if that route comes in to place. So, anyways, if you have any comments, questions, or anything like that, please don't hesitate to go ahead and write in the comment section of this chat, of this stream, and I'll be happy to address any types of questions as long as during the live. If it's after the live, it tends to be a little more complicated. The only reason why I'm saying that is I don't necessarily go on to Facebook to review everyone's questions and answer. So I try to do the best I can, basically. All right. So, anyways, let's go ahead and grab our pulse oximeter. We're going to get into our therapy now. Remember, this therapy is anything close to what you would get from me if you were coming into the program itself. Okay. Hi, Dana. Hi, Chrissy. So the program that we do at HRN, which is the Home Rehab Network, or homerehabnetwork.com, or the Mind You Lungs. The difference between those two programs, just so you know, is the HRN program is more of it's a higher level. It's a higher level. The reason why I say that is it's insurance based, and you attend 3 days a week. The Mind You Lungs is self-paced. So do you understand where that? Because it's self-paced, you come in when you can, but it's, Monday, Wednesday, and Friday, of course, 9 a.m., 10 a.m., 11 a.m., 1 p.m., 2 p.m., 3 p.m. Good morning. But anyways, that's really the only difference in it is the one self-pace, which is Mind You Lungs, and it's a subscription-based. And the other one's HRN, which is an insurance-based. So the only reason why I would say the HRN is a higher level is because you have to attend, right? The Mind You Lungs, you don't have to attend. You attend only when it's more convenient for you, in a sense. But for people that are doing very well, I just kind of want to appreciate the feedback I got back from my patients. And I have one patient that was talked about she was not able to walk her driveway, but she did a little over 3/4 of a mile, almost a mile altogether on her walk. And we have a lot of patients that, of course, are on a lot of supplemental oxygen, and they're weaned off of oxygen. Now, these things that I do in a pulmonary rehab program is I don't cure anybody. I just work the patient out. Okay, I don't just work up upper body and lower body, though. I work out respiratory muscles the most, I wouldn't say the most, but the breathing side of it, of the respiratory side of it, we're more in tuned at the Mind You Lungs and HRN. So if you go into a sound, you can't hear me, Michelle? Turn up your volume. Why are you guys making it seem like it's my fault? It's your system. I've been running the system for the past 10 years. It's so just turn up your volume, but no worries. If I join Mind You Lungs, am I guaranteed to get into your class? Yeah. I mean, it's me doing it. So yeah, of course. The program in itself altogether it depends on how bad everything is, like how sick you are. But the Mind You Lungs program is, like I said, self-pace, while the HRN is not self-pace. And that's the only difference. Now, on Mind You Lungs, can you see me? Can you hear me? Yes. Same thing with HRN. We use Zoom on both programs. Okay? But just so you know the difference between the two. So if you go into Mind You Lungs, no problem. You're going to get the same results you would with HRN. But you would get higher results if you're attending 3 days a week. but you would have to, you would have to put in for that. And 3 days a week doesn't sound like, it sounds like a lot, but it's not, because it's only 1 hour you're spending with me. And I just make sure that you're doing everything well, that you're always improving. We work out together, we educate each other, all pretty much just like any other program in the United States, except we're more breathing focused. Really, that's it. That's one reason why we are very good at what we do, is because people that have pulmonary issues, lung issues, tend to go to other clinicians that are not lung experts, I guess you could say. And they work out upper and lower body, but they don't do anything else. Maybe sometimes some pursed lip breathing, diaphragmatic breathing, but that's pretty much it. Here, we learn everything. It's about, when we counted it up, it was roughly about 1,700 different exercises about. So there's quite a bit that we do with patients for pulmonary. But anyways, let's go ahead and get started. Just so you guys know that I cannot see you. Okay, I can't hear you. I can't see you. Anything like that. So that's the only thing that I have to emphasize, is that what I'm doing right now is nowhere near close to what we do in the classes. Okay, you're getting a taste of it. You're not really getting a lot of it. Okay, because I need to know what's going on. I gotta know if you have a lung transplant, lobectomy, Zephyr valves, if you have IPF, or idiopathic pulmonary fibrosis, cystic fibrosis, alpha-1 antitrypsin deficiency syndrome. You name it. I have to know what these things are. I have to know what's going on with you, because if you have a really bad leg and I don't know that, then I'm going to be blindsided, and we're doing exercise that, let's say, requires our leg movement, but we can't move our leg. Do you understand what the difference? Okay. I just want to make sure we're all very clear with that. All right. So if you're actually serious about pulmonary rehab, after you've gotten a taste and you want the whole enchilada, right, then of course you would join into the program itself. Anyways, we're going to go ahead and get started. So, pulse ox, I plated pulse ox on my finger. I turn it on. First number shows up, it's 30%. What should I do? Let's say the oxygen shows 30%. What should I do? If your answer is call 911, that's incorrect. Because at 30%, I would be dead. So if I was seeing that number, I'm simply going to take it off this hand, switch it off to another hand, and check to see if that's good. All right. So after I see the first initial number, I wait 30 seconds. Okay? So you have to wait 30 seconds for the first initial number. It's a rookie mistake to just turn it on and look at the first number that shows up, that's displayed on it. That's the worst mistake you could ever make. You got to wait 30 seconds because your vascularity might be different from when they calibrated these. So you want to make sure that you have good vascularity there, of course. And to double check your vascularity, all you have to do is just clench your hands nice and tight, open them up, see how fast blood circulates to this hand. And probably because my hand's cold, because it's kind of cold in this garage, it's not... Yeah, this one's taking a little bit long, so I might have to warm up my hands if that's the case. Very good, Dana. You wait 30 seconds or longer. Very, very good. All right. So once we check to see if our stats are okay. Now, is 85% bad on oxygen? Is that bad, do you think? 80%. Let's say 85%. Is that bad? If you think it's bad, then why do a lot of doctors that refer patients to me, all require their patient not to be higher on saturations above 85? 85, you heard me. If that was a bad thing, then why would they say that? Hey, Alex, whatever it takes, don't allow that patient to go up above 85% on their oxygen. Why? If it's a bad thing, why is it a bad thing? Because I can understand what the doctor's trying to do. And you might not see it, but I do. So what the doctor is trying to do is lower the amount of oxygen in your blood so that it makes room for enough carbon dioxide to be diffused out of your system. Okay? So that's the reason why. Is the doctor, a lot of doctors they're more critical on your CO2 as a CO2 retention. So they're more critical on that. So they don't want your oxygen to be above 90. Some of them, and a lot of them actually, want you only be at 85. And if that was going to cause organ damage, then what's the point? So 85% won't cause organ damage at all, But that's I'm not sure that's a common misconception, but it is pretty common, and it's conceived quite a bit. So I would say it's a common misconception. Yes, I know. Yes. I'm sorry. When my puppy comes here, see, look. See this big puppy. When this puppy comes up and says, "Puppies," I have to pick her up. So that's called a hairy antidepressant right there. Okay. All right. So let's go ahead and get started now. We're going to grab our incentive spirometer. Grab the incentive spirometer. You want to do it 3 times. Now, what I like to do is I like to measure everything out, but before I measure, I want to know what my goal is. So if my goal is to increase my volumes, where's my volume at now? That's what you really want to ask yourself. So the calculation or the formula is 65 milliliters per kilogram of ideal body weight. It's cute, isn't she? Yeah. Yeah, she's adorable. Anyways, so I hold my incentive spirometer ready. I keep my back straight. I take a deep breath in. Then I breathe all the way out. Didn't go all the way up there. Maybe I need to exhale a little bit longer. 1, 2, 3, 4. Might be a little bit of inflammation. Maybe chest tightness. Let's see. Let's see if I have any chest tightness. I only went down, I'm usually always at 4,000, but it seems to be 500 milliliters less. So that means there might be a compromise. About 250 milliliters each side, maybe. That's the way I see it. So, because 250 plus 250 is 500. So if I'm down to 500, there's inflammation that's taken up around 500 milliliters of space in the lungs. So that's why I'm not getting as high as I used to on my incentive spirometer. I'm fine. I have the sniffles, but I'm fine. But I'm going to see if it's a lung stretch. That might fix it. So I'm going to take a deep breath in. Hold that breath. Breathe out. Take another deep breath in. Seems a little better. Let's see. Yeah, that was it. Okay. So the lung stretch just probably meant that my lungs got a little stiff. Lung stretch just alleviates that, and that's why I was able to go back up. So it could be technique. Anyways, let's grab our respiratory muscle trainer. Okay. Set it to its proper setting. Okay. Now you're going to place it in your mouth, and we'll go ahead and get started, okay? Here we go. Breathe in. Fill your lungs all the way up. Exhale. 1, 2, 3, 4. Now fill it back up. Fill it back up. Roll that chest up. If you're doing this or sitting or just facing straight, it's not what you want. You want your chest rolled up. So when I inhale to my deepest, watch. Did you notice that? When I inhale, my chest is about facing about 45 degrees up in the air. And when I exhale, with the delta V, my chest is facing probably about 30 degrees down to the ground. Okay? It's not, I wouldn't say 45, I would say 30. Anyways, so respiratory muscle training is done 6 times a day, 10 minutes each. Let's go ahead and finish this out. Delta V's back in the mouth. Fill your lungs up. Keep it in your mouth. Keep it in your mouth. Exhale. 1, 2, 3, 4. Inhale. 1, 2, 3, 4. That wasn't included. Thank you. Exhale. Inhale. 1, 2, 3, 4. Exhale. 1, 2, 3, 4. Inhale. 1, 2, 3, 4, 5, 6. Sip. 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 Exhale. 1, 2, 3, 4. Inhale. 1, 2, 3, 4, 5, 6. Sip. 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 Exhale. 1, 2, 3, 4. Okay. Take the delta V, bring it down to a number 4. Okay. There was this doctor in California, retired pulmonologist. California is supposed to be have taught in universities across the country. Calls me up and says, "I've been watching you for some time." I said, "Okay." I said, "That's great." And says, "You are really, really good at what you do." And I said, "Well, thank you. I really appreciate that." He says, I have another exercise I would like to show you." I said, "Okay, go ahead." So I thought it was like an upper body, lower body, but it was respiratory muscle training. Never heard of another doctor talk about respiratory muscle training. They usually don't know a lot about it. So the doctor showed me a technique, and I'd like to bring this technique and strategy up with you. See how you like it. Okay? So how this works is I set my delta V to a number 4. You can see the big triangle here is pointing at that number 4. I just turned that dial here. Anyways, so the delta V is set to a 4. So these are called panting exercises. So you won't see it on YouTube unless I'm the one, you're seeing me on YouTube right now, which I see there's a lot of people seeing right on YouTube. So anyways, so what you want to do is you breathe in shallow, okay? You breathe in and out very quickly through this delta V. And after 3-4 cycles of a shallow breath, then you breathe a little bit deeper, about middle area, okay? Filling your lungs up halfway, and then pant. Breathe in and out. And then you fill your lungs up all the way, as deep as you can get, and then you pant at your deepest breath. So, I'm showing with my hands. So this is what it should look like. Then I'm going to fill it up a little bit more. Not all the way, just a little bit more, filling my lungs up halfway. And then I'm going to pant there. After 3 or 4 times of that, then I'm going to breathe in all the way and do the same thing. Once I get there, then I'm going to breathe all the way out. And then I'm going to start the cycle over again. You want to do it with me? Here we go. Place the delta V in your mouth. Breathe out all the way first. Now pant. Quick breath in, quick breath out. Here we go. In 3, 2, 1. In and out. Now a little bit deeper. Fill up halfway. In and out. Now fill your lungs up all the way. In and out. Now breathe all the way out. Breathe in all the way. Now we're going to start the process all over again. Breathe all the way out. Pant. A little deeper. All the way in. Breathe all the way out. Fill your lungs up again. Take it out of your mouth. Cough 3 times. Okay. There you go. All right. There. All right. Just get a drink if you need to. Okay. Yeah, like I said, just get a drink if you need to. So there are different variations of respiratory muscle training. I'm just showing a few right now. I have a lot of other videos that you can explore and take a look at to see if any of them that you like. Each and every one is going to be different, of course, but each and every one is not, you don't have to do all of the exercise. I just like adding a lot of variety. So if you like to just stick with your breathing in all the way, try to fill your lungs up more when you can't. Do you know what I mean by that? When I fill my lungs up all the way, and let's say when I measured on my incentive spirometer, and that was 1,500 milliliters. Like here. Let's say, okay? Let's say it was 1,500 milliliters. That means when I inhaled to my deepest with that delta V, that's 1,500 milliliters. If I don't use the delta V, I breathe in all the way, that's 1,500 milliliters, right? So if I inhale to my deepest and I exhale, inhale, exhale, my volume is going to stay at 1,500. I don't want that. I want it to be up to 2,000. I want to be at 2,500. I want to be at 3,000, maybe 4,000, maybe 5,000. Okay? Because I'm a human being and I need that amount of air coming into my body. That's how it is. That's how it works. So anyways, when I breathe it, so if you like to just sit up without adding a lot of variety, you don't have to. A lot of people like to add variety to their exercises to kind of give some extra. But if you just want to stick with one, it'll still do the same job. Okay? That's that respiratory muscle training. Yeah, it'll still do the same job. You like that one? Yeah. All right. The other ones are pretty simple. That's where you fill your lungs up all the way. Try to keep adding air into your lungs, even though you have maxed out already. Okay. The point of that is if I inhale to my deepest and I try to keep inhaling, I'm going to notice my muscles are getting stronger because on my incentive spirometer, my volume is coming up now. Because now that I have the proper muscle strength behind me, I can do that. And of course, I'm improving. That's what you want. Can I do one exercise 3 times and the other 3 times and add them up to 6 times? Yeah, of course. Yeah, you can do that. But remember, everybody, just because you're increasing your lung function doesn't mean you don't have a problem with your anxiety, being out of shape, muscle weakness. You got to work everything out. Take it from me. I'm an expert in this, but take it from me. Okay. When testing spirometry readings with or without oxygen on, it doesn't matter. The oxygen is just to keep the supplemental oxygen is only used because your oxygen levels drop. So, I mean, you can, it doesn't influence the volume. So it doesn't matter, Glenda, with or without. But if you're supposed to be wearing oxygen, I would say use it. That's what I would say, especially if it's written up by my doctor. Doctor says, hey, Alex, wear oxygen. I said, okay, I'll wear it. I don't wear oxygen, but I'm just saying, if my doctor told me to do that, that's what I'll do. But yeah, it doesn't matter, Glenda. Okay, I hope that helps. All right. Okay. Now, we were talking the other day about saturations. And I want to kind of get into this just a little bit. But on saturations, does everyone know what the range, the normal ranges are? It's normal range is usually above 88, less than or 100 or less, okay, or above 88%. So that's the range. You're within that range, you're good. Now, if your oxygen drops down to 85, does not mean that's something to worry about. Especially if it drops down to 85 but comes back up in like just a matter of seconds. That's a normal body response. That's nothing to worry about. But some people tend to worry a lot on lower oxygen levels. So that's what I want to kind of talk about a little bit. So oxygen levels, anything around the 40s. I'm going to start at the lower end. Anything in the 40s, your heart will stop. That means you will die. Okay? So 40% saturations, oh yeah. You're gone. You're dead. You can't even. So if I was legitimately setting at 40%, I couldn't see the numbers. I wouldn't be alert, and I wouldn't be awake. My eyes wouldn't be open. If they are, they're probably rolled in the back of my head. But I'll be blue in the face. I'll be basically suffocating until my time expires. But 40%, your heart would have stopped and you would have been dead. So anyways, 50s, going to 50%, you're blue in the face. Most of the time, you're not conscious. Okay? Then you go to 60%. 60%, if you're not out yet, you will be. You're going to pass out. Okay? The knockout point for oxygen, how low it has to go for you to pass out, is around the 70s. Okay? You start seeing stars in front of your eyes. Your work of breathing is going up. Anxiety is going up. Everything is just wreaking havoc in your body. 80s won't cause organ damage. It won't. I have not seen it ever in my... I've been doing this for 25 years. I have not seen it. Okay? I've seen patients live 100 years. I have seen patients live to 100 years, and they've been sitting at 85 for 20 years. No problem. And I have legitimately seen that. There is no organ damage on that. But if it goes down to 70s, that's when I'm going to start worrying. Unless I know the person and not by their name, by their body. If I know that the person's disease and their complications, then it might be warranted, or it might be okay to be at less than 80, but it really depends on testing. You need to do these tests, not just spirometry tests like arterial blood gases. And then the doctor, not me, but a pulmonologist. I'm not a pulmonologist. So a pulmonologist, I'm under the medical board of physicians, but I'm a respiratory care practitioner. I'm different. Okay, I don't hold the MD. I hold the RCP credentials behind my name. RCP, respiratory care practitioner. Anyways, what I'm trying to get at is that most to, I don't want to get this incorrect, but most of all the doctors I know that are pulmonologists know about patients that sat around the 85, and they'll say, no, that patient's not going to die. We're not worried about the person's oxygen so much. We're worried about that CO2. That person's retaining a lot of CO2, so we need to keep that oxygen around 85, at least temporarily, until a lot of that CO2 gets relieved. So it's pretty common in my line of field to get that type of report, if that makes any sense. Yeah? Okay. So oxygen levels, perfectly fine in the 90s, perfectly fine. Down the 80s, not so worrisome, especially if it drops a little bit, comes right back up very quickly in less than like 30 seconds to 40 seconds. If it takes 40 seconds, you're fine. If it takes a minute or 2 minutes to, let's say your oxygen dropped down to 85 and had a heck of a time coming up, that might be looked at as a bad thing. We don't like saturations below 88, but there are some people that, with their disease and the severity of the disease, that require their oxygen levels, their saturation levels, not to be above 85. That's just the name of the game. Does anybody have any questions about that? with oxygen saturations and titrations? Anything? Yeah, write in the comment section if you like. But anyways, that's all I have for today is just talking about these discussions. Okay, the exercises that I want to do on Thursday is upper and lower body. But I need everyone that wants to improve their lungs to improve it with doing the right thing. And that, of course, is first, pick up your volumes. That's step number one. Pick your volumes back up. Do respiratory muscle training 6 times a day, 10 minutes each, until your volume's back up. You're going to get sore. It's just what's going to happen. But you have to do the exercise. Once it's back up, you don't have to be so aggressive. You don't have to do it 6 times a day, 10 minutes each. See, we're aggressive at first because we're trying to pick up that lung volume back up. Get up to a human volume, okay? And, the volume is shot. We have to work on that first. Once we pick the volumes up, now we have to work on the person's endurance and stamina, strength training, anxiety. Once we fix that up, then we're going to do testing to see if that person does not need us anymore, or they need to be in maintenance, which is something I always will discuss with my patients. Sorry, there was something there. Anyways, but that's all I have for today, everybody. It's not a lot of exercises because I'm trying to prep you for Thursday. Thursday, strength training, upper and lower body, weights up to 5 pounds. So if you have regular weights, great. If you have weights that are at least, 5 pounds or less, great. If you need to use soup cans or water bottles, or then maybe that's all you have, then use those. Okay. So Thursday, yes. Can lungs feel tired or stressed or feel heavy? Lungs can feel heavy. Tired? No, you wouldn't feel that. It might be tiresome, Steve, to breathe deep enough because the muscle requirement is just, it's there, but it's just at the borderline, meaning like, let's say it takes 12 pounds of muscle to open up your lungs. And let's say your lung muscles, the muscle between your ribs and your diaphragm, are only capable of pulling only 12 pounds. That means that's the heaviest it can do. So it'll be a struggle to breathe. So I would require the muscle strength to be able to, or capable of pulling 20 pounds. That means the 12 pounds of my lungs, I can breathe in rather quick. Does that make sense? Like if a weight is very heavy, if a weight's very heavy and that's your max, there's no way in the world, especially, like somebody who actually works out like I do, like a lot of us do. But we all know that if something is incredibly heavy, there's no way in the world you're going to lift it super quick. That's the same thing with breathing. So if it's to struggle to lift that weight, if it's struggle, imagine a struggle with those muscles in between your ribs. If they're very, very weak, you just have to strengthen them up. So it doesn't take so long to take a breath in. And if they're very weak, you might be out of breath just by breathing. Because the muscle weakness, if I have a weak muscle, it takes 3 times more energy to make that muscle move, to mobilize it. Okay? I hope that helps. But other than that, everybody, that's all the time I have. Respiratory muscle training, that's what we got to do. Respiratory muscle training. And Thursday, workout upper and lower body. I'll see you guys Thursday, okay?